It's the dawn of a new decade. You can be you again with mini dental implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Mini dental implants will change your life.
I've had problems with my teeth.
I couldn't eat almost anything.
I had this big hole in my mouth.
I knew it was time to do something permanent.
I'm gonna go and get this done.
It's just unbelievable what it's done to my life.
I feel like me again.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
The mini implants are the only way to go.
Just real happy I did it.
I would recommend it to anyone.
Do it over in a heartbeat.
It's been great.
It's incredible. It is. It's absolutely incredible.
Hello, everybody. I'm John DeSciullo. Welcome to Innovations in Health. We're talking about the mini dental implant procedure. It will change your life. And I'm welcoming Dr. Ganem and Dr. Derek Flum from Campbell Dental, a mini dental implant center of America, 5705 West Verner Highway in Detroit. The mini dental implant procedure will change your life. It's 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. It's an FDA-approved product. Imagine everybody biting into the foods that we love in Detroit, biting into the foods that we love here in Michigan. Coney Island dogs, Detroit deep dish pizza, steak, apples, corn on the cob, you name it. We're going to show you why in just a little bit. The mini dental implant procedure is available at this practice, and we want you to stay tuned for the next half hour to find out how you can be you again. Dr. Ganem, welcome to the show. Dr. Derek Flum, welcome to the show. I want to start by looking at a model, Dr. Ganem, that you have in front of you. It's the difference between a conventional implant and a mini. Show us the difference.
With a conventional implant, the opening is much larger than the mini implant. The mini implant, as you can see, is much, much smaller and much less invasive.
And with that, the mini dental implant is a procedure that can happen in less time and in your office.
It's done the same day.
I want to talk to you, Dr. Derek, because the dentures are so much more secure with the mini dental implant. And if you have a lower denture, people are used to it swimming around on the bottom of the gum, and there's goop, and it's just awful. But the mini dental implant procedure is such a secure technology. Show us.
Yeah, that's right. So on the bottom denture, there's really nothing for the denture to hold on to. It just kind of swims around on your bottom bone. But when we place the implants, we're able to put some inserts here, and the implant really locks in. And so you get the stability, you get the security, you get the confidence that that denture is not going to move, so you can smile, you can eat, you can talk, and not worry about the denture moving around and causing problems.
That in itself is just worth the price, because so many people have those issues where the denture falls out and they're at a family function, and that embarrassment doesn't need to be, does it?
No, it doesn't, and we can help you out with that. It's probably one of the highest value procedures we do with the mini implant.
Odds are you have a lower, you probably have an upper denture. We talked about the taste and biting into all the foods that we love here in Michigan. The sense of taste is going to come back with the way the upper denture is applied, in addition to the stability, and you have an example there.
With the upper, we put the implants on top, and they have the option of removing the palate. And by removing the palate, we get a sense of the taste of the food and the temperature of the food, which is part of our enjoyment of the food. And along with that, just like the bottom, they snap in, they're very, very strong, and you don't have to wear any adhesive, and you have the confidence of chewing, eating, and talking without having the stress of them potentially coming down.
I had a lot of difficulty in eating.
I couldn't eat 3/4 of the food that I enjoyed eating because I couldn't bite down on anything.
I hadn't taken a bite of a cheeseburger in probably 10 years.
I couldn't eat almost anything.
But with these, I can eat everything.
Well, you got to eat for the rest of your life. Do something now. So I did.
I can eat everything. It's unbelievable.
It was done, overdone. Go home and eat.
I can eat steak, I can eat sandwiches.
So it doesn't slide around or move or worry about it falling out.
I had dinner 45 minutes later.
It's secured, it's in place, things don't fall out.
I can chew a steak. I could not do that before.
I'm enjoying the fact that I can literally get a sub and just run.
I have not had a problem at all.
I don't have any problem chewing anything.
And my teeth aren't falling out of my mouth.
It's made a tremendous difference.
I would recommend it to anyone.
Best thing I ever did. I mean it.
I love it. It's life-changing.
I can eat anything I want. I'll smile at anybody, it's outstanding. I'm happy. I'm very happy.
I'm very, very pleased that I have them now.
that in itself is worth it as well, because some people have maybe a little lisp, but they have a problem because that suction is what keeps it in with the full plastic in the upper.
This is true, and they just stay up beautifully.
Yeah, and you'll work with the patient whether they have a denture or if they need a denture created.
Absolutely.
Yeah. Dr. Derek Flum, I know that the next level of the mini dental implant is what we call fixed on 6.
That's right.
And this is almost as if you have a third set of teeth. And show us why, because these are porcelain and so beautiful.
The dentures, they have the teeth, but they also have the pink plastic that comes with it. And these fixed on 6, they really just replace the teeth. There's no gums involved, so there's no bulkiness with that. And so again, we place the implants and we attach the implants onto the gums, and we can remove them for cleaning or maintenance, but at home you don't have to worry about ever taking them out. They stay in, they lock in nicely, you're able to chew and smile with all the confidence and not have to worry about the teeth coming out.
And this could be an upper or a lower or both.
That's right, either upper or lower. You know, they look beautiful, they look very natural, they fit beautifully. It's a fantastic option.
And it's a porcelain product. It's made to take a licking and keep on ticking.
That's right, very strong.
Dr. Ganem, if God gave us our baby teeth and our adult teeth, you're going to give us our third set of teeth with really the most premium mini dental implant that's available.
Absolutely. These are the Cadillacs, and with these, we put even more implants and we cement them in. They don't come out. They look good, they feel good, they last a long time, and you can chew absolutely anything you want like you had your teeth before.
And these are cemented in, so it's the most permanent procedure available.
Absolutely,
Yeah.
absolutely.
And we'll talk a little bit in just a little bit here on Innovations in Health about how Dr. Ganem has changed lives. But, you know, Dr. Derek, if somebody has teeth in the back of their mouth, you know, sometimes they say, well, it's out of sight, it's out of mind. But those back teeth are very important for the chewing, and they're the workhorse teeth. And if you have a single tooth or a front tooth that's missing, the mini dental implant procedure will help. Show us with the model how that works.
Yeah, so I mean, it really can't be overstated how important those back teeth are. The front teeth are not designed for chewing, so if you just think, oh, I've got my teeth for smiling, I don't need to worry about the back teeth. Eventually, those teeth are going to wear out.
Because that's all where the nutrients come from. You're biting into the foods. You're getting all of the goodness of what we love in Michigan.
Yeah, that's right. And, you know, I mean, without being able to chew up your food, you're going to have stomach problems. You're going to not get the nutrition that you want out of the food. And so what we can do to replace those back teeth is similar to the way we do with the dentures. Just, you know, put an implant in, and then we make a porcelain crown, and we cement that in, and that stays in forever. And, you know, you can use those like regular teeth.
Now, you know, we love hockey here in Detroit. Sometimes a hockey puck may come the wrong way. God forbid somebody has a car accident or there's some other degenerative issue, and somebody loses a tooth in the most prominent place, you know, right in the front.
Yeah,
How will Mini help you?
In the same way we can do implants in the back of the mouth, we can do an implant in the front of the mouth. That was one of the reasons that I got interested in dentistry, is I had a tooth knocked out and went through the flipper phase and then the bridge phase, and now I have an implant and it stays in my mouth all the time. So we can place an implant and then make a ceramic crown and glue it onto that implant, and again, the tooth stays in, it never comes out, you can bite, you can smile with complete confidence.
And we should mention, these are not teeth that come out of a box.
These are custom made for you so that they will match the teeth you've already got in your mouth.
And all of this is done in your office. And let me tell you, everybody, Campbell Dental is a mini dental implant center of America. They're at 5705 West Verner Highway in Detroit. Here's the number to call, 313-385-3088. The number's on the screen. And the website, if you want to find out more, is campbelldental and the number 1.com. That's where you can connect with Dr. Ganem and Dr. Derek Flum. Our dentists that are here, we want to get to know you. Dr. Ganem, how long have you been in practice?
I've been in practice for 37 years. Basically, I've been in Detroit all my practicing years.
You've been in Detroit a long time, and you are Michigan through and through.
Absolutely. I love the state, I love the city.
And your family's here?
Yes, I have my siblings and my kids, yep.
Now, how long have you been practicing with Dr. Flum?
We're practicing together for 5 years.
So how did you connect?
We met through a mutual friend.
And you work well together?
Absolutely.
Very much so.
Yeah, it's interesting to have these dynamics together because the mini dental implant procedure is brand new technology, and I know you keep up with technology as well.
Absolutely. We have the state of the art in terms of the scans, the cone beam. The latest, we have it.
The cone beam, you were one of the first really in the state to get this technology for three-dimensional imagery.
One of the first in the state, absolutely.
Yeah. And Dr. Derek, tell us a little bit about yourself. Where did you grow up and how did you get educated and become a dentist?
I grew up mainly in Colorado, went to the University of Colorado. Then after that, I got a PhD in organic chemistry at Yale University, where I met my wife. We moved to Detroit for our jobs. She's now a professor at Wayne State. I worked at Pfizer for many years, and then they closed, so I found a different profession and went to University of Detroit Mercy to get my dental degree.
So you've come to the table as a dentist a little later in life.
As I said, I lost my tooth when I was a kid, so I've struggled through having a flipper and not having the confidence to bite and smile and do the things I wanted. So I thought this was a chance to have a different job where I could kind of remedy that for other people.
Dr. Ganem, we've talked a little bit about how dentistry has changed over the years since the time you first put a patient in the chair, and you're very big on technology and you're always learning, and it's very important. And I know that you zip over to Buffalo, New York, right across the Great Lakes here, and you learn from Dr. Todd Shatkin about some of the latest techniques in the mini dental implant. Explain that connection.
Dr. Shatkin has brought a lot to the mini implant world. Advantages of the mini implants are tremendous, and we've learned from the best, and we were able to take that and provide that to our patients.
And I know, Dr. Flum, when we go to the website, there are other things that you offer as well. So if somebody's looking to get some general dentistry, or some cosmetics, or even emergency care, you'll help them out.
Yeah, we don't want to wait till you're missing teeth before we see you. So we do fillings, we do crowns, we do root canals, we do orthodontia. We view ourselves as comprehensive dentists, and implants are an important service that we provide.
And I know, Dr. Ganem, the mini dental implant is an important piece of your practice, but people should go to the dentist because you can find out so much about the patient. I mean, God forbid there's oral cancer, or there's some other issue that the patient is suffering. By going to the dentist, you'll see things through the mouth that maybe the patient may not think they're suffering from.
Absolutely. Our exams are very comprehensive, and our goal is to prevent things at the earliest stages, from that to restoring what was there before.
And I know you offer a consultation for the patient as well. Explain that procedure.
We bring the patient in, we take a full set of x-rays, we go do a thorough exam tooth by tooth, to find out when we can prevent problems down the line, and restore what's been missing once it's happened.
And when you meet the patient, you get to know them a little bit, and I'm sure you want to find out what their needs are as well. Maybe it's a cosmetic issue that they're looking to correct, or a stability issue like we talked about with the denture. What do you talk about in a consultation?
The most important thing is what motivated you to come in today, and then we focus on that to make sure that we address your primary. Now you may have something that we see, and we'll tell you about what we see. Let you know what's going on. But the most important thing is, what is the most important to you as a patient that you want taken care of, and that's what we focus on.
And it's great that you have that connection. And at Campbell Dental, you're a mini dental implant center of America, and you're 5-star rated. And in looking up online, these reviews are unbelievable, and I think what's important for the viewer to know is that with OSHA and the CDC, you are the cleanest facility around, and you follow these guidelines. And what I like, Dr. Flum, is you have what's called a comfort menu. Explain to me what that is.
Not very many people actively look forward to seeing the dentist, so we try and make you feel at home here. We have TVs in all the rooms. We have coffee and water and snacks if you need them. Just trying to make the dental experience a little bit more pleasant.
And it's great that you do that, because some people do have that fear of going to the dentist, but you don't need to have that fear. Dr. Ganem and Dr. Derek Flum are at Campbell Dental and Mini Dental Implant Center of America, 5705 West Verner Highway in Detroit. The website, campbelldental1.com. The phone number to call is 313-385-3088. Dr. Ganem, we're used to paying for our cars monthly. We're used to paying for our homes and a mortgage. And I know that you work with the patient to help them with the mini dental implant procedure so that it's an affordable option for them. How do you do that?
We pride ourselves, our staff is trained to make the procedure fit into your budget. So we want you to be able to do what's best for you, and we'll help you to find a way to make it fit into your budget.
And I know, Dr. Flum, you're going to work with that patient to make it affordable because it is an investment in themselves.
Yeah, right. We have staff that's specially trained. They have a variety of options that they can go through to make sure that we can get you the treatment that you want and fit that within your budget.
This was really affordable.
Yes, it's totally affordable. It's totally affordable.
I would definitely recommend mini dental implants to everyone.
Very happy with it. It looks natural, it feels natural.
I wish I would have got it done a long time ago.
It's the best decision I ever made, so it's well worth it.
So if somebody's out there watching and they're a denture wearer and they've resigned themselves to the fact that I'm going to have to use this goop or I'm not going to be able to eat the foods that I like, they don't need to have that anymore. This is something that you will make affordable for that patient when they come into the practice.
Yeah, we will do everything we can to help you get that into your budget.
Because we want to emphasize, everybody, that the soft foods that you're used to eating, now you can bite into the food that we love here in Michigan. The deep dish pizzas we mentioned, the Coney Island dogs, steak. Imagine this, Dr. Ganem, somebody that hasn't had the opportunity to dig into a steak, and you were mentioning corn on the cob and an apple, the crunch of it.
Absolutely. It's not only do you chew better, you feel better. You smile better. It's something that affects all phases of your life.
And it makes the confidence level of the patient come back, doesn't it, Dr. Flum? Because now they're going to be able to do the things that they want to do as a human being again and smile.
Yeah, you have so much more control with these implant retained dentures. You're not hoping that the glue holds while you're chewing or smiling or talking. You know that once it's in, it's in.
And we should mention this is not something most people think, well, the denture wearer is a little older. This is for really all ages.
Yeah, there's a lot of reasons people lose their teeth, and we get people that have lost their teeth at a relatively early age, and we can help just about anyone.
Yeah, Dr. Ganem, you have an interesting story to tell about a patient that you worked with the mini dental implant procedure, and I know it hits near and dear to you.
Yes, this is really, really life-changing. He was about 40 years old. He had a traditional denture made at another office, couldn't wear it. And he came to us and we made him the fix on 6. And he was really, really depressed when he came in. We made him the upper and lower. He had his smile back and he was able to chew. And his confidence, I mean, he went from someone that was depressed and stayed basically at home to somebody that was out. His personality came back, ended up going to work. His whole life completely changed, and it was from the procedure that we were able to provide for him. It was really, really life-changing. It was amazing to watch the transformation.
And that is really what it's all about, isn't it, Doctor?
Absolutely. I mean, it's enhancing the lives of the people that we are privileged to serve.
Well, let's hear from some more of these patients that are served with the mini dental implant procedure.
Getting the mini dental implants was a life changer for me.
If you're concerned about your looks, then obviously this is the way to go.
Not a second thought about it. I would do it again.
How could you go wrong?
I just can't say enough about how I feel.
I'm able to talk and speak with confidence again.
It's one of the best things I've ever done in my lifetime. I mean it sincerely.
When I go to the VA, I can give them a big old smile.
This is something that is so incredible.
I feel a lot more confident. My smile feels better.
It brought a lot of confidence back to me.
It's just amazing what it does for your self-confidence and how you feel about yourself.
After the procedure, wow, yeah, you smile.
But now I smile all the time.
I am very happy I had the procedure done. I feel as though I have my smile back.
It's just unbelievable what it's done to my life.
He kind of gave me my life back.
I feel like I do have more confidence than I did before.
It's going to sound corny, but I mean, it is a life-changing event.
Changed my life.
Great to hear from those patients, and check out the Smile Gallery on the website. You'll want to see how the transformation is so pronounced. Dr. Ganem, we talked about the mini dental implant. It's 5 times less. It's less invasive, less discomfort, less healing time, less visits to the dentist, and less expensive, and you make it affordable. But when we talk about discomfort, sometimes the patient has to have a little bit of over-the-counter medication, but not much.
Absolutely not. They're so less invasive that the discomfort is minimal.
So an over-the-counter ibuprofen or even a Tylenol might do the trick, if needed at all.
It was totally painless.
What pain? I had no pain.
I didn't have any pain.
It didn't hurt.
I never felt a thing.
There was no pain, no discomfort whatsoever.
One trip, it's great.
One visit, you're done.
Less trips, the better.
It's actually really painless, and I wish I would have got it done a long time ago.
So I did it, and I'm very happy with it.
I left again with a tooth that day. I took one Aleve that evening, and that was it. Yesterday, I had 4 implants put in here. I took 3 Aleve, and that was it. And today, it's just a little sensitive if I touch it, but I have teeth there now. It looks good.
It was good.
Dr. Flum, we talked about caring for the mini dental implant, and of course it's always important to go to see the dentist every now and then to get your checkup. But I know that a water flosser is something that is commonly used.
Yeah, the water flosser is probably the best tool for maintaining the cleanliness of those dental implants.
And if you want to go to the website, it's campbelldental1.com. Check out the Smile Gallery and check out everything you need to know about the mini dental implant. Now folks, if you've been watching Innovations in Health and you're hearing about the mini dental implant procedure, it might be something you're hearing about for the first time. And if you've been with us for the whole half hour, we want you to make the call because your life will change. You can be you again. If you just joined us or you're watching halfway through, there's a part of the program I want to emphasize again, and that's the showing of the models. And Dr. Gannam's going to show us with the first model here, again, the difference between the conventional and a mini with the mandible.
This is the opening that we need to make in order to do a traditional implant. And this tiny one here is the opening that we need to do for the mini implants.
Big difference.
Huge difference.
And that titanium post is what goes into the bone. And the bone actually, it's called osseointegration, I learned. The bone actually grows around that post to hold the mini implant in place.
Yes, that's where it gets its strength from.
Dr. Derek Flum is going to show us now the lower denture example. And like we said, if you're used to having it swim around on your gum and you're embarrassed, you don't want to even go out in public, your life is going to change. Dr. Derek, show us why.
Yeah, because like you said, without the implants, there's nothing for the denture to hold on to. But once we put the implants in, we can secure them to the lower denture, and they snap in, and they don't move.
And the goop is gone. Dr. Gannam, if you have a lower denture, odds are you probably have an upper denture. And we talked about the sense of taste that's going to be able to come back, the sense of salt and sweet and hot and cold, and the stability. Show us.
With the uppers, they snap in as well. And what happens with the uppers, we have the option of removing the palate. By removing the palate, we can taste the food and we can feel the temperature of the food, and it enhances the chewing.
And by removing that plastic in a conventional denture, that's the suction that kind of keeps it in place.
Yes.
But the minis hold it in place, and then that exposed palate, the sense of taste. So the barbecue that you love, the soul food, the deep dish pizza, the Coney Islands, the steaks, the chops, the seafood, all of that sense of taste that the patient may have been missing out on. They don't need to do that. They don't need to miss out on it.
Absolutely not. You'll get your ability to chew back.
Yeah. So that confidence level as well. And I'm sure you've heard from patients that have said they're afraid that their denture is going to fall out.
Yes, absolutely. And with this, you have the confidence of knowing that they're going to snap in and they're going to stay in.
But the mini dental implant is not just for denture wearers. Folks, if you have a denture, that's great and you can get it stabilized. But even if you have another dental issue, the mini dental implant might be able to make you look and feel your best. This is called a fix-on-6, Dr. Derek.
Yeah, so with the dentures, the teeth come in the pink plastic, but with the fixed on 6, we're able to replace just the teeth with a nice ceramic piece. And again, they snap on just like the dentures do, but you're not able to take these out at home. You come in, we can take them out for cleaning, for maintenance, but you don't ever have to worry about taking these out. These stay in your mouth until you come into the office.
And you can do it at an upper or do it as a lower, and a little bit higher end on the practice, but boy, what a great look.
Yeah, they're beautiful. I mean, you can see the teeth, they look like replacement teeth.
Now, if God gave us our baby set and our adult set of teeth, Dr. Gannam and Dr. Flum are going to offer a third set of teeth. This is called the roundhouse.
Yes, the roundhouse is the Cadillac. And with the roundhouse, basically, it's more implants. It gets put in, it's cemented in, doesn't come out, and it looks good, it feels good, and it lasts a long time.
And those are cemented in, so that's a permanent option.
This is as permanent as you can get.
Yeah. upper or lower as well, and the patient can be any age that may need this procedure.
Absolutely, from 20 to 95.
Yeah, because I know you've worked with a lot of patients in a lot of different age ranges, but
Absolutely.
and you make them look their best. And Dr. Flum, let's talk about the side teeth, because as we mentioned earlier, if they're out of sight, people think they're out of mind. But imagine your face is, you know, all squished in. You don't need to have that with the mini dental implant.
Yeah, so I mean, we focused mainly on replacing all the teeth, but even if you're just missing one or two teeth, that can be a big deal, especially if it's a tooth in the front, right? Nobody wants to walk around with a missing tooth in the front, so we can place an implant in the front tooth, and then with a beautiful aesthetic custom-made tooth that will match the rest of your teeth, give you your smile back.
Very important, made in America product, and it's custom designed for the patient.
That's exactly right.
And those side teeth that we mentioned earlier, those are the teeth that chew all the food and get all the nutrients out. And some people may have a bridge in the back that they've had a problem with, but the mini dental implant will fix that.
Yeah, the mini dental implants are strong enough to be used in the back teeth and give you your chewing forces back, so you can go to town on those steaks and get all the nutrients and the taste and all the pleasure that you want to get out of your food.
And like we mentioned earlier too, this is something that happens in office. So you can see Dr. Ganem and Dr. Derek Flum at Campbell Dental, a mini dental implant center of America, 5705 West Verner Highway in Detroit. Website campbelldental and the number 1.com. The phone number 313-385-3088. Dr. Derek Flum, what motivated you to be a dentist?
So when I was 9 years old, I was playing Little League Baseball, and one of my best friends was warming up outside the batter's circle and hit me in the face.
Ouch.
And knocked my tooth out. And so, you know, I've struggled with having a flipper that, you know, would come out when I sneezed and not being able to eat corn on the cob. And so eventually I got a bridge, but, you know, that broke. And so I've struggled with, you know, missing teeth. And so I thought that when I was finding a new job, a career where I could help people regain their smile, regain the function of their mouth, that would be a really good thing to do.
And you remember that moment on the baseball diamond?
Yeah, very.
Do you ever see that
very
little guy
distinctly.
anymore? He's all grown up now. Right?
I don't.
Dr. Ganem, what motivated you to be a dentist?
I like working with people. I like helping people. And it fit my passion in life.
And you've done so much for so many over many years, and you're going to continue, aren't you?
You know what? This is not a job. This is what I do. This is what I love to do. And as long as I keep my health, I'll be here till I can't do it anymore.
Yeah. Well, we're happy that you're here, and we're happy that both of you are innovators in health here in Michigan with the mini dental implant procedure. I thank you both for joining us on Innovations in Health.
Thank you.
Thank you. And thank you for watching.